know, just to reiterate, really what we're trying to do is just to help us all think about evidence-based practices, to think about some strategies for putting PSR and recovery into practice, and to develop sort of a community of practice where we can reach out to one another and to enhance what we do in our work and our lives. So. And as a Douglas College employee, we just wish to acknowledge and honour the land that we publish from today, and we wish to acknowledge the Coquitlam and Pequot First Nations, as well as all Coast Salish peoples on whose traditional and unceded territory we live, learn, play and work. After the webinar, you will receive an email asking you to tell us if we're any good or rotten, or if you have suggestions for us. So please, that feedback does really mean a lot to us. Often we don't get a lot of feedback, so for that feedback that we receive, we really appreciate it. So we just really encourage you to let us know what we could do better, and maybe just to give us some ideas for future presentations. So thank you for your commitment to our work in that way as well. We have two events that we'd like to share with you. The first of which is some colleagues, for those of you who are in British Columbia, Lower Mainland. It is a local clubhouse called New View Society, and they have been extraordinarily connected with PSR British Columbia over the years, and really try to advance PSR and recovery, as we all do, in their work. And so this is just a little notification of an upcoming fundraiser. So if you're around, having been there once myself, it's a lot of fun, and they have some really great musicians. So if you have the time to join them, I'm sure they'd really appreciate that support. Also, I just noted recently, and I'm sorry I don't have the specific details in front of me, but maybe Hazel is on the line, and she can maybe through the chat give us more details. But I understand that she has facilitating a educational opportunity for youth with mental illness in Victoria, and I believe that that's March. I won't identify the date because my old brain is not the best, but maybe we can just stay in contact, and through the next webinar we can give you more details about that as well. So early March is my recollection for what looks like a really stellar opportunity, educational opportunity. So with that in mind, I'm going to just very briefly share with you our agenda for today, and then just do a little bit more of a detailed introduction of all of our speakers. So you can see that we have a number of speakers this morning, so it's probably better that we hold questions to the end, and I will monitor the chat. And so if you have something, just feel free to pop it in the chat before you forget, if you have questions, and I'll just keep a record of them, and then at the end we'll just open up for questions. So each speaker will speak for about 10 minutes, and first we'll hear from Jen, and then Manny, and then Heather, and Bonnie, and Sue, and James. So I know that you've heard from Jen before. You've met Bonnie through our platform. I think this might be the first time you'll hear from Heather, and Bonnie, and Sue. And if you do have a look in our archives, you'll hear a really stellar presentation from James Price on culture as well. So we have a wide variety of topics, and the intent of this session was really to share how PSR principles and values influence people's work, and how it helps advance PSR and recovery in people's daily lives. So I'm really looking forward to this presentation. I think it's a very special opportunity to hear from different people who have different roles throughout the country. And so you will likely have follow-up questions, and you may wish to connect with people after this session as well. So with that in mind, we'll begin with Sue Carr, who's a former board member of PSR Canada from 2002 to 2016, and is still involved with PSR Canada in multiple ways. So we're very grateful to Sue for her work. And after nearly 30 years in community mental health, with the last years in palliative care, she's now working as a consultant. And our company, called Community Healthcare Consulting, provides professional development services in the area of workplace wellness and occupational stress for agencies in healthcare, social services, and first responders. We welcome again James, who's a community mental health worker and PSR in employment development. He's of mixed heritage, Métis, and a sojourner en route back to the Creator, invites you to walk with him in solidarity and mutual support and encouragement. He says, "Together we are stronger," and James is currently the president of PSR Canada. We also have Heather, who will speak about relationships. She is an occupational therapist with a master's degree in leadership and training. Heather has worked in mental health for 30 years and a board member of PSR BC and PSR Canada. She's currently employed by Interior Health Authority in a leadership role, and throughout her career, Heather has embraced opportunities to promote empowerment and recovery with individuals, teams, and organizations. Next, we'll hear from Bonnie Spence Vintage, who will speak about family. And Bonnie is the BC Schizophrenia Society regional educator for Cranbrook-Creston area in BC. She's a retired executive of the education with the government of Nunavut and former administrator of K-12 and Aboriginal and special education. Bonnie's a family member of loved ones living with mental illness, and she will be sharing her family's journey. And then, well, Manny, who you know, is a certified trauma recovery coach with Manual Connections. Her Desperate Women Connection outreach, providing housing, skill development, training, and formal education to trauma survivors in Cameroon. She's also one of the coordinators here with us at BC Advanced Practice, and recently the author of a book called The Cage Giant, From Victim Through Survivor to Thriver. So congratulations on that publication, Manny. Really cool to see that happen. And then Jen will speak about hope, and so she's certainly helped us, I think about this topic a lot in our work together, so we appreciate that. Jen has been working in health for the past 25 years, has managed a peer support and RAP program. In 2014, she started a company called Luminate Wellness in order to share recovery and wellness concepts with a broader community. She works with PSR Advanced Practice out of Douglas College here with us and oversees the website and communications for PSR Canada. So you can see we have a host of speakers with us today, and we're very privileged to have these great voices, I think some from BC and then other parts of the country as well. So it's really great, and I hope that you enjoy as much as I know I will hearing from these great people today. So with that, I am going to pass over to dear Jen, who will begin the conversation. Thank you, Jen.
Hello. I'm happy to be here, and I'm happy to get to talk about hope. It's such a great topic. Regina, I'm just going to stop your video there. Cool. While I share my screen right now, I just would love to ask you what your thoughts are about hope. If you want to just type that in the screen, like when I say the word hope, what does that mean to you? I would love to hear that from you right now while I sort this out. Although I can't actually see the chat. But I just want to get you thinking. Oh, I can actually. Good. So if anyone wants to write, please feel free to write. Somebody says, "Oh, Vicky, an essential for every part of our life." Thank you. Keep throwing it up there if you want to share with everyone. So we've got positive outlook, the optimism for a better tomorrow. Thank you. So excitement for what the future holds. Belief that you can recover. Good. Thank you. So I'm going to dig in. I only have about 10 minutes. So we all have about 10 minutes to cover our topic. So obviously this is it's not a very in-depth time to really dig into this topic that we could spend a lot of time on. But I do think it's important to start with hope. So I'll start with this one thing I wanted to mention, that I am referencing actually an article that I wrote for the PSR Canada website. So Manny, if you want to just throw the link up for that article, that would be great. And you can have it as further reference. I actually copied and pasted right out of that article, so you can have it almost like as a reference for later if you want. So hope is born out of the stillness of a moment when one ever so slightly begins to believe that they might be able to experience relief, happiness, satisfaction, connection, and joy. Before we dig into this, I just want to sit with that for a minute because sometimes the word hope, when we're really used to saying the word hope, when it becomes part of our vernacular, we don't stop to think about how hard hope is when you've lost all hope. It is so, so hard when you're at the depths of despair to hold on to hope. And I think as practitioners, we really need to understand just how difficult it is to hold on to hope. And then what I'm going to talk about for the rest of the presentation is how can we create an environment where people can begin to hold on to those little nuggets, tiny little seeds of hope. One thing that hope isn't just optimism. It's not just about being optimistic. It's not wishful thinking. Hope actually is the belief that in the future things will get better, and I'm going to hold on to that no matter what. But it requires vulnerability to believe in hope. It requires a lot of support to really believe in it, especially when we're first starting and when life is really, really challenging and we feel like hopeless and despair. There is a danger that we can feel around starting to feel hope, because it's like we're putting a risk out there to believe in this hope that life can be better for me. And it's about kind of reaching out to the unknown, because we don't really know. We can have all the hope we want, but we can't predict the future. We can't necessarily orchestrate things so that it goes in our way. So there is a risk involved in hope. And sometimes it can feel like we're moving one step forward, two steps back. So as practitioners, I think it's really, really important that we understand that, so that we create an environment where people can feel safe in the discomfort of holding on to hope for the first time. Once we've grabbed onto it, it can be much easier to keep holding on to it, but it is harder when we're first learning that. So there are so many different paths that people can take on the recovery journey, but we do know that every single path begins with some sort of hope. So when we are seeing someone for the first time, when they come into our office, or when we meet with them at wherever we're working, a clubhouse or wherever, do they get this message of hope as soon as they walk in the door? So that's my question for you, is imagine someone is coming into your building for the first time. What is the message that they're getting around hope? We do know that it is essential, so how is it showing up in your office? So we know that hope comes from within. We can't give anyone hope, just as we can't empower someone else. We can support someone to be empowered from within, but we can't, it has to be accessed from ourselves. So hope is birthed from within. However, as our services are likely trauma informed, I just made up this term, hope informed. Are our services hope informed? Do people get a really difficult message with no source of hope when they first get their diagnosis? What kind of messaging are people getting when they come in and receive services? And I think that's something we all need to think about in a lot of detail when we are delivering services for people. This is a quote. Parker J. Palmer is one of my favorite authors, and he is so good at describing just the soul. So I'm going to read this. I recommend buying his book. It's called A Hidden Wholeness. I believe everyone who works in this field should read that book. It's very powerful. So the soul is like a wild animal, tough, resilient, savvy, self-sufficient, yet exceedingly shy. If we want to see a wild animal, the last thing we should do is go crashing through the woods, shouting for the creature to come out. But if we are willing to walk quietly into the woods and sit silently for an hour or two at the base of a tree, the creature we are waiting for may well emerge, and out of the corner of an eye, we will catch a glimpse of the precious wildness we seek. So for me, that just says it talks about the environment we need to create if we want people to show up, we need to fully be able to show up if we're going to believe in hope. We need to be safe. This, to me, talks about safety. So what are we doing in our services that we are creating this kind of environment where the soul feels comfortable showing up? So as practitioners, we can create these environments where the messages of hope ring clear. We can create space for the inner expert to feel safe enough to come out of hiding. We can see a glimmer of hope show up within people and fan the flame. And I think that's just so important for all of us to remember to like encourage people to create that safety where people feel like they can fully be present. So there's 3 things that I've listed here, and there are more questions. I'm not going to I don't have time to dig into them, but I want to leave these questions with you so that you are able to think about it. Think about how these questions relate to your practice and how you can spend some time digging through them to see how hope is actually showing up for you. So first of all, reflect on our personal biases of maybe of hope, of recovery in general. What does recovery actually mean to me? What do I believe that everyone can recover? Is that part of my worldview? Does recovery equal having a sense of agency? Does recovery mean life satisfaction, or does it mean something else? What actually do I believe? What do I personally believe about recovery? And is it possible for everyone to experience recovery? Why or why not? And then the second one is being intentional around our language. So reflect on the following things. When I am speaking, is the message of hope reflected through the words I choose, or is the illness model reflected? So just to be aware of those messages. Am I subconsciously making a dire prediction? And am I sharing this with someone and they're hearing my bias within a dire prediction, like you're never going to work again? I know countless people who've heard so many messages like that over the years. I believe that we're shifting and people aren't receiving that message as much, but in the past it has been huge that people got really negative messages given to them. So am I fanning the flames of hope and empowerment with this comment, or am I discouraging it? With this comment or action, am I supporting the development of this person's self-determination? Manny is next, talking about self-determination and choice, or will this comment take away from their growth? Does my language inspire or support the growth of agency within this person? I have one more slide and I'm almost done. So create space for the inner expert to show up. So we can reflect on how we create even more space for people to show up. Do I actually believe that each person has an inner expert? Or is that something that I'm wrestling with? Maybe I don't believe that people know the best for themselves. So that's something, to really dig into. Do I think I know better than they do? Does the environment from when a person walks in the door to when they leave feel safe and comfortable? And do I need to work on some quiet biases that I may have that are getting in the way of the person's inner expert showing up? Because I can actually create an environment where it prevents that expert within them to show up. So I need to own that and own my place in that. And then these are my references. Again, there is a link to the article that I wrote. And a lot of what I said is about digging into your reflecting on yourself. I didn't really necessarily give a whole lot of other information, but I think it's important that we do take that time to reflect. And then the book that I mentioned by Parker J. Palmer. So thank you. That was very fast. I normally talk a lot more than that. So I'm going to pass it on to Manny. Manny is going to cover self-determination. So thank you very much.
Hello, everybody. Thank you for joining us today. As I've mentioned, and Jane and Regina before me, I'm going to talk today about self-determination. The 7th principle of psychosocial rehabilitation states that psychosocial rehabilitation practices promote self-determination. And this is a link to the website that on the page that talks about all the principles of all the principles of psychosocial rehabilitation. So if you want to go through all of them, you could visit this link. I think maybe Jane is going to put it in the comment. So to proceed, I want to start by answering the question, what is self-determination? Simply put, it is people being at the forefront of their lives, making their own choices and their own decisions. But while there are so many definitions of these, and we all have different definitions, I like to point out this one by Phil and his colleagues. It states that self-determination is defined as a combination of skills, knowledge, and beliefs that enable a person to engage in goal-directed, self-regulated, autonomous behavior, an understanding of one's strengths and limitations, together with a belief of one as capable and effective. The reason I like this definition among the other ones out there is because it brings out two aspects which I'm passionate about, and that is strengths and skills. Because despite the challenges or the illness a person might be experiencing, they still have strengths within them and skills. And if we as practitioners build upon those skills, then we help empower a person to become self-determined. So, but how does self-determination relate to psychosocial rehabilitation? From my perspective, the first thing it points out on is the person-centered approach. This is the view that service development and delivery should come from the perspective of taking into consideration the needs, the preferences, and the values of the people we serve. So, and secondly is to collaborate with people to provide what they need and what those preferences are. It could be in terms of employment, education, housing, recreational environment and activities, wellness goals, or for them to come up with a plan in any area of their life they want to have a personally fulfilling life. And as in psychosocial rehabilitation too, while providing these services, it is also important to support them. That is why if you look through our webinars, you come across some presentations on supported employment, supported education, because we believe that is another way of promoting self-determination. While you give them the choices, to also help them to get to the point where they feel personally fulfilled. So there are various best practices or evidence-based practice of self-determination. For example, there is the functional theory and the ecological model. But today I'll focus on the self-determination theory, the work of Deci and Ryan. Cross-cultural research has shown that satisfying these needs is necessary for all people's healthy development, engagement, motivation, and well-being. And while intrinsic and extrinsic motivation are an integral part of the theory of self-determination, my focus on these is the three psychological needs which Ryan and Deci point out in their work on the self-determination theory. So the first of it is autonomy. And in this context, it means making choices out of a person's free will, in line with the person's motive, their emotions, and their external demands. And the second is competence. So what does competent mean? It's the feeling of being able to meet up with the demands of one's environment or face daily challenges. It could be a challenge of just waking up in the morning. So competence is having that feeling of being capable to do it. Just like Jane mentioned about hope, it's like having that hope that this is what I would like to do. A person can fulfill this need of competence by setting and achieving desired goals. For example, the goal I just mentioned of hope that tomorrow is another day to start all over again. And the third psychological need mentioned by Deci and Ryan is relatedness. And this is the sense of feeling close or connected to other people. When this need is fulfilled, it provides emotional security and opens a person to further explore the need of belonging and is motivated to engage in tasks that involves meeting other people. So according to Deci and Ryan, these are the three psychological needs, which if we focus on these three, is going to help a person to feel more self-determined. So as practitioners, how can we promote and exercise self-determination in the people we work with without over-helping? In my perspective, the first thing is to educate. When we teach people how to set goals and how to go after those goals. If a person's goal, for example, is to weight management, we educate them on what is available out there to meet those goals. But yet we let the person have the free will to choose which of those methods we've educated them about are they going to embrace in order to fulfill that goal. And the second is to create opportunities. If we teach people how to set goals, without giving them the various options to choose from, without giving the various options to choose from in order to exercise those choices. What good would that be? In our various settings, we should provide opportunities for people to be able to exercise their rights of choices and decisions. And the third is support. Sorry, I just noticed I didn't go to the next slide. So the third is support. And we can support a person by a person's sense of self, by understanding the importance of a person's past, their present experiences, and their hopes for the future, in order to provide the resources that they need to have a personally fulfilling and self-directed life. And I would like to close here with this last slide, saying whenever we think of self-determination, let's think of this phrase, nothing about us without us. Because when we consult people, when we make our the people we provide care to, when we make them part of the decision making or part of the development of services, then we are indirectly giving them the power to be self-determined. That is why I find this statement, nothing about us without us, to be very important when it comes to self-determination. And here are my references. I think we're going to put it together and post it on the website, psyrehab.ca. Thank you so much.
Welcome, everyone. I'm going to be talking about relationships and what that looks like, what it truly means. And I'm going to share my slides now, so just bear with me for a second. So in talking about partnership and empowerment, I just wanted to embed that in our Canadian perspective in psychosocial rehabilitation and recovery. So from the Mental Health Strategy of Canada, an orientation towards recovery is helping to bring about important changes in the mental health systems of many countries. Here in Canada, recovery has strong roots in the advocacy efforts of people with lived experience and in the psychosocial rehabilitation field. Recovery and well-being form the base of this strategy and are now embraced by most provincial and territorial mental health policies. So it's a good statement, it's a solid statement, and then how do we make this real in every corner across the country? How do we create and take this important statement and make it real? I also have the theme of nothing about us without us, and I think it's a really powerful and important statement that comes out of social movement of inclusion. And it is embraced by people with mental illness and substance use and their families. And when we think about this term, it's such an important, and it's such an easy phrase to remember. And everything that we go to do in all aspects of work, or if you're coming to experience receiving services, which actually you're not receiving, I hope it's a partnership, or with family members, having that voice that says nothing about us without us is incredibly powerful. So what does client-centered mean? And I just want to talk about that briefly, because I have some examples I'd like people to contemplate. I have the fortune of interviewing people for work, and will often, ask the question, what does client-centered mean? And a lot of times people will talk about the client being in the center and all the services are wrapped around, and we make sure that the services support the client. But there are still times in this day where people miss the concept that the client's the person driving the service. They're the individuals that know their life, what they're hoping for their future, what their dreams are, what their challenges are. And so client-centered it is about people having that voice and that voice being listened to. Another example is when we're looking at planning services, and there's many service providers in the room with lots of ideas and lots of directives that are coming from various ministries across the country about aligning mental health services to best practices. And so there's lots of planning that's done, and then a family member or a person with lived experience will be asked, what do you think of this? That's not partnership. That's not building together. That is not nothing about us without us. That's tokenism, and it's better than not asking the question, but it's much more meaningful to plan together. And there's lots of examples I know that are happening now where that real planning, that real collaboration is happening. But I know that there's also repeated over time, we see many examples where that does not happen, and it leads to disempowerment for people. The voice is so important. Another example might be if you're in the hospital and at a discharge planning meeting where there's a table full of service providers, one person with lived experience, and hopefully but not always a family member or loved one. That to me seems like a lot of people in a room. That's overpowering and must be very difficult to feel that you have a voice and that you're listened to. And I think the intention is to be inclusive and to work together, but does that really meet the needs of the individual at that moment in time? Is there another way to do that that might be more respectful and make sure that client and family voice is heard? And there's many system barriers we have as well that direct us to do all kinds of different assessments, and these things are all very important. All the clinical work that we do is very important, but sometimes they get in the way of actually helping the person with the reason they came in the door, whether that's first entering a mental health center, coming to the hospital, or ongoing appointments they may have with clinicians. So I just want to introduce that idea that those are not examples of client-centered or working together. The unique voices of persons with lived experience, I have throughout my career learned so much, and anything that I've been involved in planning that's done in real partnership has been so much more successful than things that are planned without people within this community and in your own communities, in your own services. The richness of people's voices, and I just wanted to bring this idea forward. There's that expression, if you build it, they will come. Well, if you don't build together what people need, they're not going to show up. And I think that's a brilliant opportunity for persons with lived experience to have their voice and say, that's really not what I needed in the service. And so planning together, it makes all the difference in the world. Many families and loved ones, although we have many policies that speak to the importance of inclusion, find that they're left out of conversations. And a lot of times there's fear of breach of confidentiality or protection of a person's privacy. And certainly not every person with lived experience is wanting everyone in their life or all their families, and they need to have that right to make their choices about who would be involved. But a lot of times family don't feel welcomed, and a lot there, you know, even if somebody said, I don't want my family involved, if the family member calls, we can offer kindness, we can offer support, we can acknowledge how difficult it is to not be able to have a deeper conversation about their loved one, and we can certainly make sure that people are connected to resources for families to help them. So it's not a closed conversation, but it's has more limits to it. Building relationships takes time. It's a wonderful thing of listening and laughing together, sometimes crying together, as we work together in building those relationships and truly understanding. And I just have this slide. It's from the film Patch Adams. It's just an image of during that movie how Patch Adams wore this clown's nose, and he was doing that as a way to support the children that were in treatment, chemotherapy, and to bring fun and laughter and lightness and a connectedness. There's lots of other examples throughout that movie. But Patch Adams is a real man. He's a real doctor, and he's very inspiring and controversial, and nothing wrong with a bit of controversy. But you can see him in person through YouTube and listen to a lot of the wonderful things that he's done to inspire a different vision in working together towards health. I wanted to talk a little bit now in the last few minutes about power versus empowerment. So I have them linked together because it is really hard to have true partnership where there's equal voice. And I think we struggle with that and trying to make that real. There is power in knowledge, and there is also power in experience from people with lived experience and family members, and to honor that in working together and really supporting from within that feeling that of empowerment is so important. And I wanted to mention, what does empowerment mean? And empowerment is the process of becoming stronger and more confident, especially in controlling one's life and claiming one's rights. So I would argue that even when there are circumstances that might have some control, such as being certified under the Mental Health Act, it's still possible to acknowledge and support people and empower them to have as much opportunity as options as they can in their lives, and help people in moving forward. So we have lots of research and evidence that talks about true collaboration and working together. When I'm talking about working together, it can be on an individual level, working in an office, it can be out in the community, but truly working together in collaboration around care planning. It also happens on a program level. In every program you have, having opportunities for input into the services, real input and real evaluation. We're often afraid of the evaluation, but I can tell you, I love when I hear from people with lived experience that tell me what's working really well and also what's not working really well. Because if somebody has the courage and the trust to be able to tell you what's not working, that means you have developed a meaningful enough relationship that you can really hear and build upon. So I just wanted to end in regards to some more evidence and research. This comes from across the country and around the world, that recovery-oriented mental health services value respect and draw upon experiential knowledge of people with mental health problems, their families and friends, as well as staff and the local community. Facilitate patient voice and decision-making in your practice. Involve, where appropriate and with permission, families, friends, and community members in care plans. Patient and family-centered care means developing partnerships with patients and their families, recognizing their expertise by involving them as members of clinical care teams, advisory committees, and real committees, and regulatory research boards, and promoting inclusion of patients and their loved ones in bedside and system-level healthcare dialogues. So really making it real. And I would invite people even to think about these webinars that come out. Are we sitting in partnership with family members, people with lived experience as service providers as we watch these? Is there an opportunity to learn in partnership? And are there ways that we can continue to grow together as we build our capacity? I just have found myself, it's so rewarding, and I'm always learning so much when we really, truly work together. So thank you very much.
My name is Bonnie Spence-Mingy, and my husband and I are the parents of 2 adult children, adopted in infancy, who live with mental illnesses. We're also the uncle and aunt to a person with mental illness and substance use issues. One of our children has been variously diagnosed with ADHD, oppositional defiant disorder, alcohol-related neurodevelopmental disorder, and borderline personality disorder. Our other child has been diagnosed with schizophrenia. In our journey as parents, we have experienced sorrow, anxiety, fear, guilt, anger, feelings of isolation, jealousy, bitterness, depression, blame, sleeplessness, weight loss and gain, social isolation, and concern for the future. But we have also experienced great joy, excitement, great pride, and most of all, hope. We continue to learn about living each day as it comes. At this point in our journey, we have one child happily part of our lives and one sadly not a part of our lives. Our niece is no longer living. There are many reasons why this has happened. The types of diagnosis and the physiological and psychological impacts of the mental illnesses, chronic substance use, the degree of intellectual capacity, the social, academic, recreational, and employment successes and failures, the successes and failures of extended family and community support, and the successes and failures of the healthcare system. Over the years, we and our loved ones living with mental illness have engaged with special needs daycare, family doctors, school teachers and administrators, special education staff, school counselors, school psychologists, community recreation and community social program staff, the RCMP, city police, the criminal justice system, mental health clinicians, psychiatrists, drug and alcohol counselors, the forensic system, probation officers, street support workers, homeless shelter staff, lawyers, social service social workers, private detectives, and that is a story of its own, banks, employers, landlords, private counselors, psychiatric hospital staff, emergency room staff, mental health boarding house staff, IH, MHSU case managers and support staff, Narcotics Anonymous support groups, Alcoholics Anonymous support groups, the FASE Society, pharmacists, and the BC Schizophrenia Society. Some of the experiences that we and our loved ones living with mental illness have had with these services and programs and staff have supported our loved ones' recovery journey, and some have not. The recovery journey for each of our family members has taken its own pathway. Supports provided include the use of medication, clinical treatment by mental health staff, subsidized housing, residential psychosocial rehabilitation, and support from family and friends. Supports that have not been provided or have been inconsistently provided include the recognition and acceptance that as family members we have valuable information to share, our inclusion on the support team from the beginning, regular communication between ourselves as caregivers and the case managers, consumer-driven recreational and social activities, preparation and assistance with gaining employment in the bigger world, supported education, peer support, coordinated mental health and substance use support services, and cognitive remediation to address cognitive deficits. We believe the recovery journey is a personal and social journey of self-acceptance, social acceptance, positive relationships, and purpose in life. It's based on a sense of hope, and we've heard about that this morning, and is unique to each person. It cannot be forced or willed into being. Believe me, we as parents tried that, and it doesn't work. However, the environment can be created in which the recovery process for people living with mental illness can be nurtured by believing in them and standing by them, encouraging them on their journey, listening with patience, moving away from only focusing on the illness and symptoms to focusing on overall health and strengths, helping them to learn how to have a more active control over their lives, recognizing and supporting that there is no one-size-fits-all approach, using language that carries a sense of hope and possibility. And we also heard that this morning. Helping them to see themselves as a whole person and not as an illness. And recognizing that the recovery journey can continue even though symptoms reoccur. The mental illness of our loved ones create crisis and persistent stress that affect all members of the family. This environment creates the potential for individual dysfunction as well as family breakdown. My husband and I continue to build resilience by finding ways to manage stress, build our individual and couple strengths, as well as seeking out resources to help us be adaptive. Thank you for inviting me to share, and I look forward to questions.
Hi. As Regina did such a wonderful introduction, I'm going to give you a little bit more of an introduction to who I am. Regina covered the employment, self-employment, and what I'm currently doing. I'm also working, my company is working as the registrar for PSR Canada. So many of you have seen me or heard me from membership and registration for the CPRRP. Excuse me. I'm also married, and I live in Barrie, which is in central Ontario, about 100 kilometers due north of Toronto. I am a CPRRP and still maintain my CPRP with our colleagues in the United States, PRA. I have 3 cats and 2 horses. And in addition to being a former member of PSR Canada, I'm also on the Ontario chapter board. The topic that I'm talking about today is holistic approach. So what is a holistic approach? It is looking at the big picture. As practitioners in various disciplines, we tend to get focused and are well trained in certain aspects. For example, vocational workers are really well trained in helping people develop work skills. Psychiatrists and physicians are focused on the physiology, etc. But when we are working within a PSR perspective, we need to step back and look at the whole person. We need to look at the context in which he or she is living. So we must look at the waterfall as much as we're looking at the stones in the foreground. And that's why I added so many personal elements to my introduction. It's important for us to get to know the people that we're working with, the people we're supporting, in a very broad view. In fact, our competencies, as I'm involved with the CPRRP, so I'm well supporting in the competencies. Competency C 6.3 states has knowledge and conducts strengths-based holistic assessment approaches, including readiness, functional assessment, needs, and resource assessments. Furthermore, our code of ethics for both individual practitioners and organizations emphasizes the need to include a holistic approach in everything we do with the folks we're working with. So this is my interpretation of the mind, body, spirit holistic approach. It's important to understand that each of these different spheres interacts with each other and is very much affected by each other. We need to look at the person's physical well-being, the mental well-being, and their emotional well-being, all within a context of values, culture, and beliefs. Any interventions or supports that we're providing need to look at, is this going to work with the person as a whole? If it's not going to fit with their values, cultures, beliefs, and is not going to look at their emotional status and their physical well-being and their mental well-being, interventions are doomed to fail. Looking at the Substance Abuse and Mental Health Administration, they've actually come up with a model of 8 dimensions of mental health. This is available on their website, and I encourage you to take a look at the resources available at the SAMHSA website. They have some great YouTube videos as well as a lot of information delving into some really deep aspects of this model of 8 dimensions. So breaking it down, there is the PSR living, learning, and working and social aspects. In their model, they take down the living and break it into both financial and environmental aspects of living. as well as overlaying the physical, mental, and spiritual. So I really encourage you to take a look at this. Sometimes it might be feeling a little bit overwhelming, but as long as you're looking at stepping back and looking at the person within their whole context and what interventions, needs, supports are required. That doesn't mean that we need to be, as practitioners, we don't need to be experts in all areas of everything. But we do need to understand where the client's strengths are as well as where their needs are, and make sure that we're referring to people who do have expertise. So being able to look at the whole picture, understand the whole person, not just as with the folks that we're working with, but also perhaps with our colleagues, and also taking a step back and looking at our own needs and making sure that all of our needs as practitioners are being met so that we're arriving well prepared and solid to support others. As practitioners, we do tend to stay away and shy away a little bit from spirituality as a topic. Having spent a number of years in the palliative care field, that's one area where they're getting fairly good at integrating the healthcare components with the spiritual care components. Not perfect, but it is improving. And by spirituality, I don't necessarily mean religion per se, although for many people, religion does have significant overlap. But by spirituality, I'm referring to a person's connection to him or herself as a being, person's connection to others, the person's connection to something greater than themselves. Some people will call this God, nature, the universe, whatever term people use, and the person's sense of place within this context of the universe or God. So making sure that you step back and understand some of those aspects and how that interplays and works with the interventions and supports and goals and aspirations of the person you're working with. Taking an example from my work in palliative care, pain management is a huge component of that type of healthcare, particularly when you're dealing with people who are approaching end of life. Managing pain is a huge focus, and some aspects around that are not just managing the physical pain, but also managing the spiritual and emotional pain. What I mean by that is people who are dealing with unresolved family conflicts, people who are perhaps concerned about what happens after death. What is afterlife like? What does death feel like? Especially folks who maybe haven't been as good people as they think that they maybe should have been to be able to enter the next realm of whatever they see as being the next level. So people can experience a lot of physical pain as a result of their emotional and spiritual pain. And it's amazing just when those aspects of physical or as spiritual and emotional pain become resolved or are addressed, the amount of physical pain that is experienced is significantly reduced to the point of people being able to be on almost no pain medication. So it's very important to understand that mind, body, spirit are all interconnected, and interventions need to be addressing and be consistent with the person's view on all of those. Just in closing, because I know that we're wanting to save time for questions, Patricia Deegan, no discussion on holistic health would be complete without addressing the work that Dr. Patricia Deegan has done. It's foundational on her work on personal medicine. She does have some great videos, some YouTube videos, and a number of different resources. If you just Google Patricia Deegan, I've put some links here. But she's really the first person to really explore and understand how truly significant a person's recovery is around their own personal interests and things that make them feel good and aspects that are not related to more of the traditional medications and traditional interventions. So in closing, I'm going to leave it at that because I expect that there's going to be more questions coming up. But also just when we're talking about working with clients or patients or whatever people that you're working with, whatever the term is for how you relate to them, you need to also understand that this applies to yourself, it applies to your coworkers, it applies to your family, it applies to everything. People are complex beings, and we really need to look at all the different aspects of everybody. So thank you.
Thank you so much. And I think, James, it's over to yourself. Thank you for that, Sue.
Hello, everyone. Today, I'd like us to take a look at the importance of diversity. And of course, diversity is our advantage, because if we embrace and celebrate diversity, together we are stronger and we can make things much better. PSR and diversity as an advantage shows that if we embrace our unique and authentic selves, and we celebrate that hope and recovery for individuals in all of their diversity, in which people live, work, and play. Diversity and inclusion promotes hope and recovery and builds better communities. There are many dimensions of diversity, such as identity, primary, secondary, organizational, and cultural, which we'll take a look at a bit later. Some intersections of diversity are age, gender, socioeconomic status, religion, sexual orientation, disability, culture, race, and ethnicity. Diversity is our advantage. And this is just a short quote from a writer called Emily McDowell, which I'll look at later as well, which says that finding yourself is actually returning to yourself. It's an unlearning, an excavation, a remembering who you were before the world got its hands on you. This is the diversity wheel, which of course shows some of the dimensions of diversity, which are disability or challenges, sexual orientation, religion, socioeconomic status, gender, age, race, ethnicity, and culture. Diversity, of course, is our advantage. It's like the quote from the Archbishop of Durban, which says, "Each of us are angels with only one wing, and we can only fly by embracing one another." By embracing the mosaic of diversity, we can only be better and stronger. These hands represent the I am. I am resilient, I am hopeful, I am happy, I am me. There are many dimensions of diversity. Of course, the first one is identity, and the primary ones are age, sexual orientation, gender identity, ethnicity, your mental, physical ability. The secondary ones are religion, education, geographic location, your communication style, your marital relationship, your status, your appearance, your working style, your language or accent, and your parental and family status. Organizational diversity includes such things as your industry, your union affiliations, your level in a company, your role in a company, your location, your tenure, your management status, your work experience, your networking, and your division or department. Cultural diversity, of course, is your power and authority views, your body language, your sense of time or punctuality, your being or doing, your cooperation or competition, your conflict resolution preferences, your tradition and your observances, your personal space, your individual or team, and whether or not you're a flexible or a structured person. These hands represent what I would call the I am. If we think of the 5 basic components of being human, which of course are our personality, our spirit, our soul, our mind, and our physical body, if we look at these 5 basics, then really embracing diversity and culture in PSR is really about honoring and uplifting and upholding all of these 5 components. So basically, if we all raise our hands and just shout out, I am, because what it does, it's a study of what there is. It's sort of like ontology, the study of being or the study of I am. It's an acknowledgement of self and also an acknowledgement of existence. It's a salutation and celebration of the I am. It's and not being the I am in terms of religiosity, because sometimes, there are songs, about the great I am. It's about the great I am that exists in each and every one of us. Sometimes people will ask me, what do you do? Who are you? What do you do for a living? Sometimes if I'm having a day when I'm more characterized by flippancy with a tendency towards levity, I might say to someone, who am I? What do I do? What do I do for a living? I breathe. Because that's the essential component. But really, in many respects, who am I in terms of a breakdown? Because people like to categorize things and put things into compartments. In many respects, I am Native, I am Irish, I am British, I am Asian, I am Northwest Russian and Finlandian, and I am Scandinavian. But most important, I am me, I am my own unique individual, my own unique self, And, you know, in many respects, we should look at someone and say, not, you know, who are you, what do you do, but embrace the more the I am factor that is in each and every one of us. And when we think about finding ourselves, Emily McDowell says that finding yourself is not really how it works. You're not a $10 bill in last year's winter coat pocket. You are not lost. Your true self is right there, buried under cultural conditioning, other people's opinions, and inaccurate conclusions that you drew as a kid that became your beliefs about who you are. Finding yourself is actually returning to yourself. It's an unlearning. It's an excavation. It's a remembering who you were before the world got its hands on you. So if we think about the mosaic of diversity as being like a mirror, and mirrors, what do mirrors do? They reflect, they illuminate. So if we reflect and illuminate, the diversity is our greatest advantage. And also if you think of a mirror, because sometimes people are, we think of people as being broken or defective because we like to put labels on things. Like sometimes when I would first meet a participant, I'll say, you know, tell me about yourself, who are you? You know, for example, I'm Jim and I'm schizophrenic, but as opposed to a person saying, you know, my name is Jim and I'm a person who's living with a diagnosis of schizophrenia or whatever other label that we put on people, because certainly people don't say, you know, I am cancer, I am diabetes, you know, I am whatever. But it's interesting in the field of mental health that we often forget and keep the disparaging stigma factor. It still exists, unfortunately. But if you think of us in terms of culture and diversity as being mirrors, as being reflective, as being illuminating, when you think about it, let's take a mirror and smash it into tiny little pieces. A tiny piece of a broken mirror is still a mirror. It still reflects and it still illuminates. That is why it's so important, as one of the core values of PSR, to focus on culture and diversity and to celebrate and to embrace it and to share it and to create a more connected world that's networked as opposed to alienated. That if we create that reflection and that illumination, that life is so much better for each and every one of us. And it's not that we're looking down on people, we're embracing one another, and we're truly being, you know, angels with broken wings, and we're truly embracing one another and flying off to bigger and better things. It's so very, very important to embrace that culture, that culture and diversity factor as one of the really important values of PSR, because what it really does for us is it creates a world and an environment in which we look at each other and from a strength-based perspective as opposed to, you know, from weakness. And even if you look at the title of today's presentation, you know, from value to validation, it is so validating when the values are placed in action, when they're more than just words, when they're really, you know, values in action. And when people see those values and they see the way that we approach people and that we embrace people, those values really validate people. Because of course, you know, personally, and I'm sure for many people as well, I heal when I'm heard. And that's what the values do. They're to create a mechanism or a forum whereby people are heard, their voices are heard, and they're understood as opposed to being analyzed. So I'm hoping that in terms of today's presentation, that all of the values really go together, and the different panelists and speakers, that, you know, I hope that people saw a flow and a networking, despite, of course, some of the previous technological glitches. It's, you know, sometimes technology is a blessing, and sometimes it's a curse, and sometimes it's a challenge. But I think that speaks to today's world of technology, that, you know, behind our laptops and cell phones, sometimes we get lost. And even though it should facilitate communication, sometimes it's an impediment. And I think it goes, the challenge is upon us to overcome those obstacles, and to maybe, sometimes technology is good, but maybe sometimes we need to look at, instead of being caught up in the world of technology, to be caught up in the world of embracing one another and going back to the old-fashioned values and the ways of actually validating and acknowledging, you know, who we are, and to just embrace the I am. And I would encourage everyone, you know, in any perspective, from a self-affirmation, from a self-esteem perspective, just to throw your hands in the air and shout out, you know, to the sky, to the creator, to whoever you believe in, that, you know, I am. You know, it's like many songs, I'm dating myself. If you think of Helen Reddy, you know, I am woman, hear me roar. You know, I'm strong, I am invincible, I am power. And of course, I'm not a woman, but of course I did come, you know, to the world by virtue of a woman. But if we just look at I am, and that is really what the to me, when I think of culture and diversity, those two words just come to me. I am, and it's not, a song in a church or in a synagogue. It's just the essence of being. And I think that's what the value of embracing culture and diversity really does, is it right in deep inside in our DNA, to me, it wakes up the I am that is in each and every one of us, in the spirit of PSR, in the spirit of moving forward, in the spirit of being welcoming, engaging, and empowering. Thank you so much, and I hope that what I've said makes sense.
So just maybe we'll just begin by saying a big thanks to all of our speakers. And I think from my perspective, it's certainly very eclectic presentations from a number of different people. I heard some impactful statements, such as hearing about the safety for the soul to show up, hearing about notions of relationship as it's linked to self-determination certainly gave me pause to consider some more ideas. And the idea about client-centered being the client driving the services. And I think often we don't quite hear those two ideas together. Very grateful to Bonnie from hearing about just the range of supports that Bonnie engaged with, that Bonnie and her family engaged with. I think that was, to me, extraordinarily impactful. Just to hear the list, I really appreciate that too. And so also we have Susan, so just give me a wee moment to read Susan's thought here, question really, maybe. So Susan says, can people clarify if you and the PSR community believe in the existing of agnosthenia, the brain-based inability of many people with psychosis to understand that they're ill? This is the reason that many people with schizophrenia, when they're psychotic, don't seek or agree to treatment. It sounds like PSR's commitment to self-determination can just end up leaving more people lost if untreated, if in untreated psychosis. Does PSR oppose involuntary treatment? So I guess we have many important and large questions there. And so I'm not sure if anybody wishes to begin to answer some of those questions. My goodness, I seem to have, okay, okay, so that came in on the question, and maybe what I'll just do and cut and paste that into the chat box. So Susan kindly put that in the question box, and maybe just to keep it all together, we will just keep that in the chat box. So thanks for that. Hopefully.
Hi, it's Heather here. I'd be happy to answer that question just from my perspective.
I appreciate that. Thank you.
Okay, so I'm not representing everybody in PSR Canada for sure, but I know it is often a challenge, and we absolutely recognize that within the brain, people have a lot of difficulty at times being able to have insight into understanding that they have an illness and that the illness requires treatment. And I think it's one of those big challenges, because we know when a person does have an understanding of their illness, and they're able to participate much more in planning and talking about what medications work and don't, and side effects, and the Mental Health Act I think is really important in BC and across the country to support people when they're very ill and where they're at extreme risk and need the medical care that they would not seek on their own. Having said that, I work with many people over the years who have those experiences, but it doesn't mean that takes away all of people's rights. And it's certainly, I'm always looking at how can we support you? What are your interests? How can we help you to move forward in your life? Where are you wanting to live? Are you looking for work? So I don't think the concepts are incompatible with each other. It's about how we approach, how we bring hope, and certainly recognizing there are times in a person's life where that struggle is really difficult. And I think families are often incredibly helpful, and friends, to be able to support people in those difficult times as well.
Thank you very much, Heather. I really appreciate that comment. I'm not sure if others have comments as well. So love to hear from anybody who might wish to respond to Susan's question. So questions, multiple. So just the existence of agnostia and ideas of a commitment to self-determination can end up leaving people untreated with psychosis. And do we oppose involuntary treatment? So just wondering if others have comments as well. And feel free to type. Yeah, and just to let you know that we're working with James to get his sound working and come back to him when we're ready. So thanks, Sue, for turning on your camera, and others as well.
I'll just jump in there and say that I think Heather did a fantastic job of responding. Coming from a palliative care background more recently, and dealing a lot with things like dementia and Alzheimer's and that, really just sort of focusing on where people are at and helping them if they've got some discomforts around where they're living, where they're working, what their goals are, and starting from that. And as you start to work with the person and develop that trust, then you can start, chipping away at the self-awareness about, any challenges that they might be having of a nature that are sort of perhaps psychotic or not, part of a good picture, and helping to build in that insight into their situations.
Bonnie, I'm not sure if you have things to add as well. Love to hear your voice in this conversation as well, and others, of course. Maybe people on the line wish to add ideas as well.
Well, from a family perspective, well, we would be recognizing that people, the whole issue of self-determination is critical. Also acknowledging that the anosognosia does exist for, unfortunately, a number of people, and to not provide the option of treatment for people based on their level of illness and their inability to understand the circumstance is very disturbing for families and very concerning for families. And of course, I always go back to things like Xavier Amador and the whole LEAP strategy as a way for people to begin to address that. And through the family support groups that I've been involved with, we have talked about that extensively, and people have learned how to use that and found it to be effective in a number of cases where the person, their belief that they don't have an illness becomes not the issue. It's more an issue of what is a common goal we can work towards, and what is it that we need to do in order to achieve that goal. Using the example in the book, his brother does not want to be hospitalized, and so how do we avoid the hospitalization? We don't really focus on the fact of the illness, we focus on a common goal. You don't want to be hospitalized, we don't want to be hospitalized. What strategies can we employ to avoid that happening? One of them happened to be taking medication. We didn't pursue the issue of do you or do you not have an illness? So do people have anosognosia? Yes, I firmly believe that some people do. Do people have a right to self-determination? Yes. It's a matter of how you juggle that and what strategy you can use to employ that. And Sue kind of made some reference to that as well. It's a big issue for a lot of families, big issue.
Yeah, and probably a big issue for our society in general. Thank you, Bonnie. And you may know that Susan is also a family member as well. So I really appreciate that rich conversation that helps us also understand things from, from different stakeholders' perspective. And, I guess none of us, we want to be a society that supports people who are ill. That is, I think, what we want to do in general. And I think that you speak to really providing as much opportunity for input from the person receiving services or as possible. And there may be a time when that person really is maybe not able to and might be a danger. We spoke to the Mental Health Act that people may need more support. So thank you very much for that very important conversation.
Can I add one thing? This is Jen. I apologize because I was working with James on the sound, so I didn't quite hear what everyone said, but I just have one thing about self-determination. I think sometimes when we're supporting people in their self-determination, it doesn't have to be a huge thing. Like if someone's not able to make a decision that's a huge decision, they can still choose what they want for breakfast. They can make choices within their day. And I think that's a really huge piece, is the opportunity to choose. And it's also within the whole idea of trauma-informed practice, like the safety to be able to choose small things in your life. And I think depending on where someone's at, self-determination is going to look very different for someone who's like fully living on their own, doing well, has a job. That's going to look very different to someone who is in a unit, in an acute care unit. It's going to look different, but there still is an opportunity for some kind of self-determination, in my opinion.
So just wondered if anybody else has any other questions for anybody specific, or if you just want to throw out some ideas in general, please do so. Yeah. So Susan asks, does PSR believe that everyone is capable of competitive employment? Does it still support the value of supported volunteer work? So I'm not sure if anybody wants to take some of those questions on, or part of it.
I can speak a little bit to that. I worked for a nonprofit organization, and we had several employment programs, from supported employment, where people were supported the whole way along, to employment, having employment counselors, where people moved into competitive employment. And I think it's not for us to decide who is capable and who isn't capable. I think we should be compelled to offer options again for everyone, and have that supported employment option. And I think I saw people go in who were very unwell, and they ended. I worked with a woman who was very unwell and not at that point not capable of competitive employment. She was in supported employment for a number of years, now has a full-time job, her own apartment. So who am I to know what someone is capable of? But if we offer options and choices and opportunity, we open up the possibility for people to do whatever they're able.
Yeah, I just want to say I agree with Jane's perspective, because I also believe we should let people make the choice of what employment they want to go into, and offer the support while they are in that employment if they need it. Yeah. So that's what I wanted to add to what Jane said.
And it's Heather here. I have a real passion for employment, because I know it's one of the primary things that people with lived experience are looking for as contributors to society, and making money and all the good things that come from working, self-esteem. And I do, in fact, believe that if a person is motivated and really desires competitive employment, that we don't know what the possibilities will be, what the right match is going to be, what people are going to learn, or where they're going to go in their careers. We have so many examples of people with lived experience that are doing amazing things across the world, Patricia Deegan being one of them. And so we don't know what a person's potential is unless we listen to their dreams and support them. And employment is an area I've seen so many people be successful with. So I do believe that everyone who wants to be employed can be employed. I also believe in the value of volunteering. I think they're very different in terms of their focus. And if a person wants employment, we should focus on employment. And if a person wants volunteering, we should focus on volunteering. I've seen it happen so many times that I am a believer.
So I realize there's a little bit of a sound addition there. I apologize about that. Hopefully that will settle down in a moment. And so Heather, I know that you have extensive experience too, just in developing services, employment services in your local area. So I really appreciate that comment too. Susan also asks about supported volunteer work. And I guess I would answer that in somewhat similar way as well, Susan. I think that in truth, in the literature, that's one of the shortcomings of our current knowledge. And I think what we do know is that we haven't always been extraordinarily successful at matching people's needs and hopes and dreams to the volunteer position. But I do think that volunteer work can be a very powerful opportunity for some. And I think that we always focus on the employment, and for some, maybe volunteer is a route that they are more comfortable with, or it might be a beginning, or it might provide that sense of meaning and purpose in people's lives. So I think it's a very valuable pathway for people forward, for all of us Canadians. So I hope that begins to and I guess we're speaking, Susan, as well as a number of individuals, and some of us are members of PSR Canada and BC, and then maybe others not. So just maybe keeping that in mind as well. So I know that you're asking questions that are what does PSR believe? So just want to give people the opportunity to just represent themselves as well. Alrighty. Just wondering if there are any other comments or maybe questions. We have a couple of more minutes, unless people are hungry and need to go for lunch, which we totally understand as well. So Susan says that I find volunteer work as a way to provide people with confidence that they can return to a workforce, an opportunity to reduce stigma in the community. Yes, and I think just my caution was too that sometimes we're not careful enough to match the person's skills, abilities, needs, and values to a volunteer position. And I think that's been an unfortunate experience. But I think once those things are matched well, I love to hear your story. And I think that's certainly my experience as a clinician too, that it has been a very powerful opportunity. Yeah.
And just like to add a little bit to that, also when people are volunteering, it gives them a chance to contribute back to society and the greater good and the greater system. So it's not just seen as a step towards employment, but also a way of connecting to life, to the community, to things that you value.
Absolutely. Thank you for that, Susan. Yeah, and as PSR people, we often talk about just notions of citizenship. And I think being able to participate and contribute, as you say, are key elements of citizenship, that we strive for. Thank you for that. Yeah. So wonderful questions, wonderful, powerful questions that are coming in on comments. And I just maybe leave it open for another minute or two and see if anybody wants to, or even panelists have something that they said, whoops, maybe I should have said that, or they have a final comment.
I have something to say.
Right.
One thing that I find so exciting about this, what we're doing here today, is the gathering of people who believe in the recovery model and believe in recovery-oriented practice, and the fact that we can gather and share thoughts and ideas and all of that, and as well from the people who are in the chat, you're a part of this too. And to me, it's like, it just represents the whole idea that this is a growing body of knowledge, PSR, and everyone has a chance to contribute. And I'm going to make one little plug for PSR Canada. We are looking at developing a community of practice that is an online community where we can do this kind of thing on a regular basis. So if that's something that interests you, connecting with people from throughout the country to talk about PSR practices, we would love to have you be a part of it. In order to be a part of it, you need to be a member. So either your organization would be a member of PSR Canada, or you can purchase an individual membership. So I'm just going to put that out there because I find that this is a big, huge piece of PSR, is the connection, the opportunity to hear different perspectives and learn from people and broaden our knowledge. So thank you.
Thank you for that, Jen.
I just wanted to also add that it can sometimes feel daunting and discouraging at times, moving forward and trying to support a recovery model and a really wonderful, meaningful way of working together. And it does take a lot of resiliency. It does take looking after yourself, building resiliency, believing and hope, and working and connecting with others and being inspired by others who also share that vision, for me, is a way to really keep my cup full. And certainly that include family members, people with lived experience, and other mentors within the mental health field. So I think sometimes it can feel like an uphill battle, and I like to reframe it as not a battle and look for those places where there are people that can really be inspiring and help us, and there's opportunities everywhere. And those are the things that throughout my whole career have kept me hopeful, and I think that's important for all of it.
Well, wow. Thank you. So beautifully said, Heather. Thank you.
I had to say it.
Yeah, I think I want to just celebrate something that happened today as well. And people just shared about their beliefs and values around PSR and recovery. What I really valued as well was practical examples, because I think we can all have these airy-fairy ideas, but what does it really mean? And, you know, I very much appreciate the practical application. And I think I heard this thread about just these notions of belonging through this whole conversation today. And I think it's hard for any of us to become the person we want to be without that sense of belonging, whatever that might be. This is my own personal belief system. And I really just bringing back to the notions of relatedness with Manny as well. And also Bonnie, I really heard from your presentation, just your focus on keeping yourself and your lovely man healthy as well, and the cup full, to use your language, Heather. And that is, I think, a great way to end the session about just that need for self-care. And I know Jen does a lot of work around helping people delivering services and loved ones take care of that self-care and fill that cup and sense of self-compassion. And so maybe that speaks to, maybe we need to do a session on that, Jen. But yeah. So thank you very much for being here, for being with us. You are our community. We can't do this work on our own, because it's not only a little sad, but we're not going to make any difference unless we're in relationship with each other. Love to hear your feedback. So you will get a link asking for feedback. Love to hear if you have things that you'd like to hear spoken about, or if you have something that you want to speak about, please do let us know. Thank you all again, and we will see you very soon.
Thank you. Bye.
Thank you. I'm just going to add one quick thing before everyone leaves, is we get a lot of people emailing us about certificates, that you want a certificate for your time here. So we ideally would love to have an evaluation back from you, and then we will also post a certificate on the PSR Canada website. So I will send you the link in a couple days for that. And then you can fill in your own information. But
alrighty.
Great. So, thank you, everyone.
Yeah, thank you for the opportunity.
Thank you for being with us. Thank you very much, each and every one of you. Thank you. Bye.